All right, let's take these classic GI pearls and turn them into a quick, memorable trip through the GI tract.
So here's the plan. We're starting at the top and heading down. This should make these patterns really stick.
Okay, let's dive right in. First stop, the esophagus. You've got to know these key findings.
See a narrowed B-ring? The clue is right in the name. Just think, shot, beaky ring.
Okay, what if you see multiple concentric rings? That's a classic sign for eosinophilic esophagitis.
And if the esophagus looks kind of shaggy or has these plaques, your go-to diagnosis is candidiasis.
Two big clues for Barrett's, either a reticular pattern or a high stricture with a hiatal hernia.
Ah, the famous bird's beak sign. That smooth taper? It's the absolute hallmark of achalasia.
And outpouching at that weak spot, Killian's dehiscence? Yep, that's a classic Zenker diverticulum.
All right, let's keep moving. Next up, we've got key clues in the stomach and the duodenum.
So most tumors stop at the pylorus, but if you see one that crosses it, think gastric lymphoma.
Seeing multiple ulcers but only in the stomach, your #1 culprit is chronic aspirin use.
But what if those ulcers are in the duodenum or jejunum? Now you should be thinking Zollinger-Ellison syndrome. Moving on to the small bowel. Now, context is everything here, because some patterns look alike.
Okay, see some sand-like nodules? It's Whipple's, unless that CD4 count is low. Then it's MAI.
What about a ribbon-like bowel? That points to graft versus host, or maybe long-standing celiac disease.
Celiac has a few classic looks: the moulage pattern, fold reversal, and even those cavitary nodes.
And that hide-downed or stack of coins look? That's a dead giveaway for scleroderma.
All right, we're almost at the end. Let's hit our final stops, the colon and some key syndromes.
You see a featureless lead pipe colon? That is the classic textbook sign of late ulcerative colitis.
On the flip side, that telltale string sign from severe narrowing, that just screams Crohn's disease.
Here's a weird one. Massive thickening, but no obstruction. That's a huge clue it could be lymphoma.
Okay, let's wrap this up by connecting the dots with a few must-know GI syndromes.
All of these have bowel polyps, right? The trick is just remembering what else goes with them. So, you've done the tour. Now, which one of these patterns are you going to spot first in practice?